I'm going to talk about CVA. So CVA generally means cardiovascular accident. It's nothing but what happens like the blood vessels in the brain just blocks, or there is no passing over the blood in the brain. The circulatory system of the brain affects. In that way, what happens, one part of a body gets paralyzed. Maybe when the brain is affected on the left side, the right side of your body gets paralyzed, and when it affects the left side, the other side of the body gets paralyzed. So this is commonly and mainly of CVA. So CVA generally happens on road traffic accidents or any other like harsh things, that when you get hit to your brain suddenly and with lot of forces, or mainly road traffic accidents, we see lot of CVA conditions, and it is mainly common in geriatric conditions. So normally a CVA patient, what happens, like one side of upper limb or the lower limb gets paralyzed and they can't move. So generally when a patient of a CVA comes to a rehabilitation condition, first of all we just assess the rehabilitation condition, and we just check the muscle tone, muscle power and the grip, and what side is affected, is there any erythema, edema or something, any swelling. We completely assess the patient on the first day, and then we start up with the bed exercises. For example, like passive movements, for which side it has been affected, we just treat the side that is not affected side, it is treated with passive movements, and non-affected side it is treated with active movements. So passive movements and active movements on the bed exercises are the first things, are the major roles of physiotherapy in a CVA patients. Then as days goes on, gradually what we do, we tend to mobilize the patient, for example from the bed towards the ground. For example, like we make the patient to sit stand, and then we start up with the mobilization. First we start up with the bedside mobilization, then we go on with the wheelchair mobilization, and we mobilize the patient, and we then train them the balance and coordination. After the balance and coordination, we use a lot of splints, and we use orthosis, prosthesis if there is any muscle stiffness or everything. So we properly assess, and gradually with the help of equipments, and we even use electrical stimulation to stimulate the muscles if it is possible and needed. And we go on from the wheelchair mobilization, we train the patients with parallel ball walking, and we give them cycling and other balance and coordination exercises. We give them mat exercises for even more gait training also. And from balance and coordination, it goes on with gait training, and with gait training we just assess the patient's walking, we assess the spine movement, the posture, and how far the patient is able to walk, how far the muscles are good. So we, from the mobilization, goes on with the mobility, and we make help in the ambulation. So it goes on like with the balance and coordination, gait training, and last is the ambulation. We help the patients with walking with walkers, cranes, clutches, how far the patient is possible, comfortable. We use all the things, equipments, and we get in the ambulations, and we further proceed in this, and we treat the patients properly with well equipped manners. Thank you.